to paraphrase it, it will be like, I am entitled, serve my needs.
I am the one who is suffering, and hence I am entitled to being understood, which also frees me from the responsibility of understanding what you are feeling. मेरे को जो बोलना है वो माफ है क्योंकि I am suffering. Period.
हम यहाँ पे फ्रॉइड पे अटके नहीं रह सकते, हमें एडलर का मेथोडोलॉजी लेना है, राइट? और यंग पे काम करना है, कार्ल यंग में काम करना है. I think hello. Welcome to yet another video of NewTrial Zone. Today we are going to talk about various aspects of therapy speak. You might have heard this new age lingo and weaponization of perpetual victimhood. You know, it is the title is weaponization of victimhood, but I just added that perpetual element to it because those who are victim, those who have enjoyed being a victim, do not want to get out of it. And people usually around them suffer because of them. So yes, we have Amaresh Nath, and your host for today is going to be me, Harish Bhuvan. We are going to be talking about these topics. We have reviewed close to 5 to 7 videos. Those will be linked in the description down below, so you can watch each video at your convenience and then come back to this video to watch the review on those videos. Having said that, Amaresh, what do you think about therapy speak, weaponization of victimhood? I mean, people are confusing mental health with moral policing also.
Correct.
What is your thought on that?
I will completely agree on that. Because it's kind of a trend where if I don't believe in something, if something is disturbing me, I will be putting labels on it, and not just any other labels, labels which are used by professionals to diagnose severe mental health concerns. Terminologies which are part of the symptomatology of those diagnoses are used left, right, center. For example, if somebody is not agreeing with me, तू मेरे को gaslight कर रहा है. If somebody is maintaining high levels of boundaries or maintaining standards, you are narcissistic. If somebody is forgetting something, oops, my ADHD brain is at work.
हमको जिंदा मत छोड़ो सालो, हम कोई मंदिर का घंटा है कि कोई भी आके बजा जाता है.
And the list can go on.
Control. You are attacking more than 80% of the population out there.
Control.
What are you doing? Do you want to get all the strikes that are there out there in this one single video? I mean, do you realize what you're talking about?
Definitely, I realized what I said. And that is why I had a smile on my face, because this is something, despite being a serious concern, is often laughed at. It is often minimized, trivialized. And somewhere यहाँ पे मैं ये भी कहूँगा, something that we say in every single video, if what we are saying is getting you triggered, it is an indication to look within, because it is reminding you of a business that is unfinished.
Okay. So let me bring in a real life example here. What about the actual person who has gone through some sort of mental health diagnosis? Let's take our brand ambassador for the mental health in India, Deepika Padukone, right?
Yes.
She has been diagnosed with depression. She has opened her own organization, to combat this widespread phenomena, with this widespread ailment across the country. What do you call that?
अरे कहना क्या चाहते हो? On the surface level, yes, very admirable. I will not call it moral policing. But when we look at aspects of nuances, For example, there was a relatively recent time, about I think 20, when was it? I don't really remember, but it was an episode from Coffee with Karan where Ranveer Singh and Deepika Padukone were
I know.
there.
It was 2018 ka episode.
Ah.
Yeah.
So there is a moment in the conversation, in the interview, where Deepika talks about how when she was in a relationship with Ranveer, she was mentally committed to him, but was actively looking for other men, other prospects of romantic pursuits.
क्या बात कर रहे हैं?
Cut back to a few years prior to this, in another conversation, when she was in a relationship with somebody else, she was talking about, I am very committed to a relationship. Frivolous behavior in a relationship is intolerable to me.
I do remember her narrative that, when I am in a relationship, I'm in it.
Yeah.
And then cut to 2018, she's talking about that I'm mentally committed, but I was also looking out for prospects. You should have seen Ranveer's face in that interview.
Yeah.
Yep.
सच्चाई छुपाई गई, अफवाह उड़ाई गई, बात कुछ और थी, बताई कुछ और गई.
Absolutely. And here, even if we give the benefit of doubt of human, being human, इंसान गलती करते हैं, but the concept that I would like to bring here is hypocrisy, doglapan.
Some would argue that this is moral policing. I mean, it is her choice whether she wants to be in a one relationship or multiple relationship. The aspect of monogamous versus polyamory.
Absolutely, it is her choice. However, she cannot impose that choice to somebody else. For example, if we draw a parallel to another controversy from the celebrity kingdom, Ranbir Kapoor, he was slandered left, right, center as the playboy and being the cheater and all those things. I'm not saying what he did was justified, and I'm not saying what he did was acceptable. But if somebody can be outraged at his behavior, why is Deepika Padukone's behavior being normalized and accepted?
Okay, I do get it. So it's not moral policing. Would you call that Deepika showed symptoms of NPD?
I mean, not an overt type, overt aspects of it where a sense of entitlement is there when somebody justifies their behavior for the experiences that they have had. So, yes, traits and symptoms can be noticed.
Okay. Good. That brings us to the next segment of today's video, which is rise in non-professional diagnosis.
इतने बड़े आदमी के बारे में ऐसे बातें करते हो?
तूने मुझे कुछ बोल दिया. Okay, let's take an example. You say that you are sad. मैं तुझे बोल दूंगा, अरे तेरे को तो डिप्रेशन हो गया, अभी क्या कर रहा है यार? Like, let's assume for a minute that both of us are not psychologists. This is happening in day-to-day conversation amongst friends, where these topics are so loosely used. These topics, no, these labels, these diagnoses are loosely used. What are your thoughts on that?
Indeed, the right phrase to use here, loosely used. Diagnosis is something which is something to be taken into high levels of seriousness. And by loosely using these words in everyday conversations, it is diluting the intensity and the gravity of people who are actually suffering from those mental health conditions. For example, a person who actually suffers from OCD, obsessive compulsive disorder, knows how much frustrating it is. It is almost like being caged in their brain. But normal parlance में क्या होता है? Somebody is organized, likes to have things in a meticulous way, stop being OCD.
Yeah. Again, bringing the focus back to therapy speak.
Yeah.
Can you give a couple of other examples where the labels are not used, but other things are used? Like, in introspection, I would like to draw my boundary and I would like to withdraw myself from this conversation to safeguard my mental health.
चले एक काम कर 200 रुपए दे और 50 रुपए काट ओवर एक्टिंग की वजह से
So,
what do you think about those kind of
absolutely.
sentences?
And बहुत सही पकड़ा तूने कि it's not just about labels of diagnosis, but other words. Prime example being जो तूने कहा boundaries. In the name of boundaries, I isolate. In the name of boundaries, I cut people off. In the name of boundaries, I avoid taking accountability and responsibility of my behavior. एक तो वो हो गया.
क्या बात है सर, क्या बात है सर, क्या बात है, ये बात है, अरे सर क्या बात है.
And mental health care is what I am focusing on. So I do not want to engage in this conversation. Your words are very condescending in nature, and I am feeling very triggered.
Yeah. So, Amaresh, that brings me to a question which I think viewers will also have, which is, then how do you set boundaries? What is the way that mental health professionals are intending when they say set boundaries and enforce them? What do they mean by that?
To put it very simply, boundary has nothing to do with other person.
Nothing to do with
The other person.
the other person. Okay.
एकदम इन्होंने वक्त बदल दिया, जज्बात बदल दिए, जिंदगी बदल दी.
For example, boundary is not going to look like something in the lines of तू मेरे को डिस्टर्ब मत करना भाई.
Okay.
Rather, what boundary is going to look like is तू अगर मेरे को डिस्टर्ब करेगा, मैं तेरे को भाव नहीं देगा.
Okay.
It is what I am going to do when my standards are not being met, when I feel uncomfortable, when I feel my expectations not being met.
Wait a minute.
So isn't that isolating what you previously said?
In a
So
way,
how does one person, just a second, let me carefully, meticulously curate this question, because we are trying to confuse our viewers less, right? So you said should not isolate. Boundary setting should not ideally isolate yourself. But the example you gave, if you are going to bother me, I'm not going to dignify that with a response. That is also in a way isolation itself. So how can this person set boundaries in a healthy fashion?
So here comes communication. Here comes expectation setting. It is not about stonewalling कि तूने मेरे को irritate किया, मैं तेरे को कट्टी करके चला गया. It's not about that. It is about you and I having a mutual understanding and agreement of how our relationship is going to look like. What are our mutual expectations from each other? What are the roles and responsibilities from each other? What are the things that I like? What are the things I don't like? What are the things तेरे को पसंद है? What are the things तेरे को पसंद नहीं है? And all the plethora of conversations which make a relationship healthy. Despite that,
Understood that. I'm talking about अभी मैं तुझे परेशान कर रहा हूं, तू भाव नहीं दे रहा है. How is this not isolating? That's my question.
Okay. भावना देना can also be multifold. One
Okay.
is being passive aggressive. मुंह फुला के बैठा हुआ हूं,
Hmm.
बात ही नहीं कर रहा, तेरा कॉल्स इग्नोर कर रहा, मे बी तेरे को ब्लॉक लिस्ट पे डाल दी. That is something that I would deem to be immature, unhealthy.
Okay. Okay. So all the
But
toxic red flags of this relationship these days that we talk about.
correct. On the other hand, if I say कि भाई अभी मेरे को तेरे से एंगेज नहीं कर रहा,
Hmm.
we will talk about it later, and in a very dignified manner, I get along with my day.
Okay. Okay. So this is what a mental health professional means when they say set boundaries.
Yeah. And enforced it.
Perfect. Perfect. अब इससे यही एग्जांपल से हम कनेक्ट करते हैं आज के पूरे टॉपिक को. मजा आ रहा है, राइट? अब तूने बाउंड्री सेट कर दी,
हाँ जी.
मैं हो गया विक्टिम, मेरे को लग गया बुरा, राइट? आई हैव बिकम मार्टर. एंड अगर मेरे में, जैसे आजकल के लैंग्वेज में बोला जाए, अगर मेरे में नार्सिसिस्टिक टेंडेंसीज है, कहा जाता है ना, इफ आई एम अ नार्सिसिस्ट and you have set a boundary with me, oh my god, you're gonna face a wrath. Right? How I can convert the entire narrative and make it all about you, when in the beginning I was bothering you, you set the boundary that you are not going to engage, and I have made it suddenly all about me by using a formula.
जोर जोर से बोल के लोगों को स्कीमें बता दे.
The loop, the famous
Yeah.
DARVO loop: deny, attack, reverse victimhood. You were the victim, now I am the victim. Reverse victimhood and make you the offender. DARVO. Right? Now, how do you tackle this? Because therapy speak अगर use करेंगे तो मुझे narcissistic ही बुलाएगा. How do you tackle this? Let's say there are some tendencies in some people who do this actively. They don't know it, but they do this.
Correct.
How do you tackle this situation without actually bringing in the labels or unprofessionally diagnosing me in this scenario, and still get to the matter in hand without getting offended?
So, couple of things I would do. First thing that I would do is initiate conversation. If that is a possibility, if the relationship allows that, I would initiate conversation. And during the conversation, I would bring evidence. I will be using I statements.
Okay. I statements, yes.
And we'll try to bring in elements of compassion, elements of understanding into the conversation. Is it possible to see the scenario through your lens?
What you're asking of yourself is such a high price of a healthy communication.
Okay.
Because मैंने डार्वो किया है, मैंने तेरे को ऑफेंड किया है, अभी तेरे से विक्टिमहुड छीन ली. You should be more enraged, because this is my coping mechanism. Whenever I feel threatened, I become the victim. So you should be all the more threatened and enraged and angry towards me. But what you are asking is to do something totally flip. How is that
Yes,
possible?
I am. तो अगर मैं तेरे एंगर को रेसिप्रोकेट करूं, I am doing exactly what we spoke about in the first episode. Rage baiting. I am getting rage baited.
Oh, so DARVO technique is rage bait.
Yes, it is.
Nice.
Okay.
So I will not get rage baited.
Okay. That is the healthy way to go about it.
Yeah.
Perfect. Now I want to ask you something which is often in line with narcissism.
Mm.
The differences between narcissism, psychopath, and sociopath. What
Mm.
what are the key major things which are distinct about these three diagnostics? Because these are all
Yeah, they are
diagnoses, right?
diagnosis. Yeah.
Yeah,
So I would say every to the larger terminology would be psychopathy. So a psychopath is somebody who has narcissistic tendencies and has sociopathic tendencies. But
correct.
every narcissist does not necessarily have psychopathic tendencies, and similarly, every sociopath does not necessarily have psychopathic tendencies. And another distinction here I would like to bring in one of the videos that we are going to add to the description. There is a line कि psychopaths are born while sociopaths are created.
I remember that. Psychopaths are born that way. Sociopaths
Yeah.
are made. Wow, what a powerful statement.
Yeah.
And how is narcissism different from sociopathy and psychopathy?
So when we talk about sociopathy and psychopathy, we are pretty much talking about antisocial, delinquent aspects of
Correct.
behavior. Narcissism is a subsection of it, which is more to do with the sense of entitlement, a sense of
Grandiosity.
mass ego. Grandiosity
Grandiosity.
is,
Yeah.
yeah, grandiosity is a major aspect of it. So when we are looking at a person whose locus of control is external, but locus of focus is internal.
क्यों हिला डाला ना
Very, very clever wordplay there. Yes.
So that is somebody that we can call a person with narcissistic tendencies or label them in clinical sense of NPD.
Correct. What about the people who live with these people? क्योंकि मैंने ये भी आजकल बड़ा ट्रेंडिंग होते हुए देखा है कि people who come to therapy are actually the victims of those people who need therapy.
Correct.
Pow.
That is true.
Those who need therapy don't show up in therapy. Is there a way to bridge that gap? I mean, for our viewers, if they really want to send people whom they really think because of whom they are in therapy, is there a way to send them to therapy? Just a curious question. Even if we don't have answer, it's okay. It is a question worth thinking about, so I'm asking it.
Definitely, it is a question worth thinking about, and there is no one single solution that fits all because every family is different, every individual is different, every dynamic between family members are different, and not just family, but any relationship dynamics are different. But if I have to go through a mandatory rule of thumb, right, it would be something like what I was saying when it comes to boundaries, trying to understand whether they are able to see what they are doing. Are they able to recognize that they need help? अगर help चाहिए उन्हें, if they recognize that they are willing to go to therapy, which is very rare.
Yeah, exactly. They are unable to recognize, no? Hence the question.
Yeah.
Okay.
But if they are not, then it's our internal boundaries and taking care of ourselves too.
But in short,
Also,
वो याद रखना है कि ये taking care of ourselves में isolation ना आ जाए. Because a
absolutely.
lot of people in the name of boundaries are doing that. So
True.
keep that in mind, viewers. And that reminds me about taking care of yourself, boundaries ke chakkar mein. How, when there is an actual problem, let's say there is acute mania, or let's say there is grief, or depression, let's say, because and anxiety also. There is actual diagnosis. They have went to a clinical psychologist or a psychiatrist. They might also be under, genuine medication, or, for grief, they have gone through a loss in their life. There is void. But मैंने ये भी नोटिस किया है कि प्रोलॉन्ग पीरियड ऑफ टाइम में क्या हो जाता है कि they are entitled now that I am going through this, leave me be. It To paraphrase it, it will be like, I am entitled, serve my needs.
And
what do you have to say
paraphrasing
about
it,
what do you have to say about these kind of people who consistently are hiding behind it? Yeah.
so here also, these kind of people are displaying strong traits and symptoms of narcissistic tendencies, because here the person is unable to see the perspective of the other person. They are seeing the entire experience through the lens of their suffering. I am the one who is suffering, and hence I am entitled to being understood, which also frees me from the responsibility of understanding what you are feeling. मेरे को जो बोलना है वो माफ है क्योंकि I am suffering. Period.
I mean, that is so sad. What to do about such people? I mean, see,
Also,
because let's take this example. They are grieving. You can't tell them stop grieving.
correct.
So how do you sensibly put this forward to those people that you are behaving like an entitled person? I also exist in this relationship.
So, if communication and conversation is possible, that would be my first go-to.
Okay.
If possible, being the critical ingredient.
I'm not very convinced with that answer, but I'm saying it's okay. Okay. Anything else?
So, second option for me, if that fails, is telling them, okay, don't want to engage with you. We will communicate. We will converse later.
I knew you would say it was boundaries. First is communication, second is boundaries. Anything else? Because this we have spoken about. Communication was your first solution. Then boundary setting, boundary enforcement was your second. As and when we are progressing in the topic, I want more advanced solution, because this is an advanced problem. Probably like a life hack for general people to not hurt the person going through the actual diagnosis, but also having that self-respect towards yourself.
Personally speaking, my self-respect has nothing to do with the other person. So, वो कुछ भी बोले, मेरा self-respect affect होगा नहीं.
Very good. But जानबूझ के मेरे स्पेस को एंक्रोच किया जा रहा है, एंटाइटल्ड बिहेवियर मुझे दिखाया जा रहा है, और मुझे एज ए स्लेव बिहेव करने को बोला जा रहा है.
So when it
So
goes
it
to
is
that
encroachment.
extent,
No, it is encroachment.
so when encroachment is that evident, then I have two choices. One is aggression.
What would you do?
Aggressive response for me would be something like, your situation does not justify your action.
और अभी तो रुको, क्लाइमैक्स अभी बाकी है.
By the way, viewers, disclaimer: if you are getting triggered, it is something that you need to look within yourself, because if this is affecting you, which means you were entitled once upon a time. Yeah, continue. Aggression, ऐसा लगेगा.
So I can try to understand why you are doing this, but I'm not going to tolerate it anymore.
Which you said, step number 1, communication. Step number 2, for boundaries. This is step number 3. We know this. Step number 3, aggression. ये एग्रेशन का कोई ऑल्टरनेटिव है? स्टेप 3B, ये 3A था.
Step 3B would be letting other people know so that they can protect themselves from the entitlement of certain people.
क्या बात है सर, क्या बात है सर, क्या बात है, ये बात है. अरे सर क्या बात है.
My God. Communicating on their behalf
Yeah.
so that you save the sanctity of all the remaining relationships in the surrounding.
Yeah. I might be
Advanced
sounding
tactic.
petty.
No,
I might
it is
sound
not petty. No, it is not petty. It is in fact a grand gesture that you are taking care of the larger community. And if you kind of bring this person in front of a mirror, they will have to take responsibility. Right?
Of course.
Because they are refusing to take responsibility.
आईना दिखाना पड़ता है. That is also a form of compassion towards them.
Yeah. Tough love जिसे कहते हैं, therapy speak.
Yeah.
So I think refusal to responsibility would be our way to end today's video. If you are choosing to refuse to take your responsibility, because देखो, eventually you have to take responsibility. मानता है? It boils down to that.
मानता भी हूँ, disagree भी करता हूँ, because we take responsibility for other people, for ourselves we take accountability.
समझ रहे हो? समझ रहे हो आप? समझ रहे हो?
And how other people respond is not truly our zone of control.
एक बात बोलूं?
बोल.
Controversial है लेकिन बोल दूंगा.
बोल.
Accountability तू ले या ना ले, तू responsibility तो ले. Because you're sabotaging relationships. You be accountable when you're ready, because you have an actual diagnosis. So you will take your process, you will take your time. It is okay. Take accountability at your own sweet time. But take responsibility immediately. You are a grown-up, you are an adult. Act like one.
And जैसे Alfred Adler ने कहा था, what happened to you should not have happened, but अभी क्या करना है?
अभी क्या करना है? हम यहाँ पे फ्रॉइड पे अटके नहीं रह सकते. हमें एडलर का मेथोडोलॉजी लेना है, राइट? और यंग पे काम करना है, कार्ल यंग में काम करना है.
Yeah.
I think that is the most beautiful conclusion we've had so far for any of our video, and we will leave it at that. What do you say, viewers? If you have any thought-provoking curiosities, please drop your comments in the comment section below. If you like this video, like it. If you feel like somebody whom you want to communicate this to but are unable to send this video of ours to them, they might
let this video be the mirror.
Let this video be the mirror through you, for you, to you.
Yeah.
Nice. So with that, I think I will take a leave. See you in the next one.
Yes.
Amaresh, over to you.
Yes. See you in the next video, everyone. Take care.